Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. Hi there. My name is Abby Tyler. I'm your host. Welcome to my show. We are going to be, as you can see, the topic there says questions to ask before taking a prescription. There's so many questions to ask your provider when you get in your prescriptions, but we're going over the top six ones. Okay. So, as I always say, my disclaimer, I'm a provider, but I'm not your provider. So please do not make any changes to your regimen before checking with your provider first. So let's get right into the topic there. Alrighty. So let me just get my notes and I'll put my glasses on. Okay. Alrighty. So what are the 10 top six questions to ask your before let me preface this by saying I also did a show a couple of weeks ago that talked about making sure you're not diagnosing yourself through the internet. So this is also goes back to that too. So you may be reading things from the internet and saying, okay, I'm going to my doctor's office and I'm having these symptoms and whatever's going on, and they're going to prescribe me a medication. So I don't want, how do I know you're giving me the right medication? The most important thing, like I always say, to make sure you have a good relationship with your doctor or your provider. You have a good rapport, so you're not too afraid to ask any questions, and you're also not intimidated, or you find yourself back and forth having, every day having confrontation with your doctor and all that with your provider. Okay, so make sure you have a good relationship, and you're not going to be buddy buddy with your, if that's the case, it's fine, because some people have their provider who are their family members or friends or something like that, and sometimes it doesn't have to be a family member or friend, but you can have a good rapport so you feel free and you feel comfortable when you go into the office to have this conversation. By the way, this also applies to people who are in the hospital setting. If you're a patient in the hospital setting and they're prescribing a medication for you, even those in long-term care, and if they prescribe a medication for you and the nurse comes in and said, this is the medication you're supposed to be getting, you have every right to ask what it is medication for and the name of the medication, what is it for. And make sure if you're in the hospital, though, when they give you the medication, make sure you ask them about the medication before you take it. Don't wait till it's already completely open and it's in a cup and they're handing it to you, and then you ask, what is this for? What is this for? Because certain medications kind of look the same. And the medication at home could be a different color than your medication you're taking in the hospital. So ask those questions before doing that. Okay. So let's get right into it. So at this point right now, and where we are in the internet age and everything else, we're happy that most people are taking an active role in their care, in their illnesses. They're learning more about it on the internet. They're learning more about it through different health sites like this and different health sites, reputable health sites too. But I always tell people that making sure that you go to your provider and make sure whatever we're doing is personalized to your care, because a whole lot goes into us prescribing a medication. So we're not just coming there, and you come in there, you might say, okay, well, I read over here, this medication was for this. Why are you prescribing this? Why are you prescribing a smaller dose? Why are you not prescribing this other medication? So everything is personalized to your care. Okay, so it's good. And anytime the provider prescribing a medication for you, you want to make sure you ask that question. Be like, okay, just tell me. Of course they'll tell you, this is what I'm prescribing the medication. And I tell my patients, I said, this is what I'm prescribing the medications for you, this is what's supposed to happen. Do you have any questions for me? Okay, so what to ask. So let's get right into it. Question one: what will happen if you don't take this medication? Now they prescribe a medication. Let's say they prescribe a medication for blood pressure. You say, okay, I don't know, I don't want to take any medication for blood pressure right now. I can do this. What will happen if I don't take the medication? Okay, so you can say, I'm looking down. I would turn the paper, the computer to the patient. I say, this is your blood pressure. We've been tracking your blood pressure for a couple of months now, because usually if your blood pressure is high, if it's absolutely high and all that, I'll tell you, come back in a couple of days, or come back in 2 week or a week or so. If it's dangerously high, you go into the emergency room. Okay, but if it's there, I said, this is the medication. We always start a medication at the lowest dose in order to be able to build up from there. We don't start real high and then you have to go. So we start you at the lowest dose possible. All right. And it will tell you, okay, this is the medication. Whatever happens if I don't take the medication? Well, if it's a blood pressure medication, you may not have any symptoms for a while. I may say, okay, you don't take the medication, your blood pressure will continue to be high. First of all, when you have like, your blood pressure start continue to be high, it does affect your kidneys over time. It does affect your major organs, your heart and everything, your head. So you could have suffer a heart attack. You could suffer a stroke. You start suffering chronic kidney disease. So there's so many more things, and your blood pressure is really high too. That also affects your eyesight over a period of time. So you may choose not to take it, but I have to tell you what it is that what's going to happen if you don't take the medication. Now there are some medications also that we may give you. Let's say I'm giving you a medication for cholesterol, stuff like that. And I usually don't, especially if you're younger, woman of childbearing age and all that. And we say, okay, you sounds like you probably got some cholesterol from your family, but you also have to watch the cholesterol. You get it on your own. So I may see your numbers and I may say, okay, I'll give you a couple, maybe 3 more months. We'll check the blood work again. If your levels are still high, we have to start talking about medication. I may not go right to like, all these statins, like you get Lipitor, atorvastatin, all those different things. I'm doing a generic and brand name. We can do that. But you also at the age where you plan on having children and all, we can give you that. We have to hold off on that. Of course, if it's dangerously high, you're going to be, you could suffer a heart attack or a stroke later. Also with cholesterol, you may not have any feelings. So you may walk out of the room and say, okay, no, I don't want to do it. I'll take my chances. And then we document that too. Excuse me. We document when we tell you, we explain the risk to you and tell you everything that needed to be done, and you decided you didn't want to do that. Also, I can say, okay, let's wait. We'll do it 3 more months and then see what it is. Make sure you're eating healthy, make sure you're changing your lifestyle, you exercise and all. So hopefully your numbers will be a little better, and we can just say, just continue with dietary modifications and lifestyle change before you do that. Okay, so you want to ask that, and don't be adversarial about it. Make sure you just sit down and talk to your doctor about that. Okay, so there's a prescription like again, like in weight, and you can check your levels again. And when they do tell you to have your levels checked again, make sure you have it checked. Okay, don't say, yes, I've been doing okay now, but and I'm eating healthy, so I don't need to go back to the doctor. I don't need to get my test done. No, you do need to have it done again because we have to be able to compare it. Okay, we don't just come right out the gate and give you medication. We track the levels over a period of time. Okay, number two is taking this drug your only option. Okay. Sometimes the pill is not the only option. Again, like we say, if you're taking medication we give you medication for certain things, we might say, okay, no, we don't need to give you medication. But remember, a whole lot goes into before we prescribe the medication. So it's not like we're not just looking at you, you tell us one and one, and we give you the medication. Again, like I said, somebody might say, well, this person had that and they didn't give them any medication. Why are you giving medication? Again, everything is personalized to your care. I look at your risk factors. Okay, sometimes somebody also say, oh, well, I read the internet and they said this and they recommending this. I say, okay, I told you. If I say, I'm giving this medication because your cholesterol level is high or your blood pressure is high, I'm looking at your risk factors. Okay, your blood pressure may be high. The other person may not have the same risk factors as you. You're older male or older female. Okay, postmenopausal or menopausal years and all that too, where your body starts losing the protection to protect your heart. Also, you have family history. If you told me a family member had a stroke or somebody had a heart attack, that's the reason why when they come to us, we do your whole family history. So we'll do that. Okay, the medication may not be the first option, is always not the first option. And so we'll tell you, go ahead again, exercise, do some other stuff. But there's some things where the medication, what if you have like severe panic attacks? What if you have other things that are like crippling your life and you have come to us after a period of time that we have said this? So we're not just giving you the medication simply because, okay, yeah, yes, we give you the medication, and you also still have to do behavior changes too. Sometimes you may need something. You say, okay, my family member died and I need some medicine just to help me out. You may need a medication just to help you out, but at the same time, we will tell you have to follow up with therapy too. Or you may just have to go to therapy and see if that works, and then you may not need a medication. Okay, because every medication that you take, regardless of what it is, hard, not benign, but every medication is like just as important. But at the same time, even if you're taking too many vitamins, it could have some side effects. So we talk about that before we decide that. So you ask that, is taking the drug the only option? So we'll work around all the different options. Again, most of the times it's dietary changes and lifestyle change, but some illnesses require medication, especially like if you're diabetic and your numbers start going up, and we tell you we've been tracking it for a while now, your numbers keep going up. What you're going to take, you will give you choice. You don't have to take any medications that's ordered to you, by the way, that's prescribed for you. That's up to you. So when you come back and we look at the numbers and we saying you haven't been taking your medication, we're going to be documenting that you're being non-compliant. So when something happens later on, you cannot come back and say, okay, why did you tell me that? We explain everything to you. And sometimes we even give you printout on the risk of the disease that we're telling you to treat you with. Okay. So, alrighty. And you can say, okay, like even with type 2 diabetes, again, like I said, with dietary modifications, your A1C, I'm going to do a show on diabetes next month. With A1C, you can always bring this number down. Like I always tell people, type 2 diabetes is completely reversible. But when you come to me and when we do your blood work and your introductory A1C is very high, way past the point where you're probably going to start insulin right away, we're not going to tell you go home and do dietary modification. We may tell you that, but most times we'd be like, okay, let's start you this medication. You can start working and get the number down, because you cannot be walking around with a high A1C. Eventually it's going to affect your kidneys. Eventually it's going to affect your circulation. Eventually it's going to affect your heart and your brain. So we have to get this number down to where it's safe for you to be able to conduct yourself. And you might say, oh, I don't feel anything. I don't need to. This doctor just saying this one just saying that just to get my money. We explain all that to you. Okay. So question 3, what are the risks and benefits of taking this drug? Right here. All medication, again, like I said, all medications have risks and benefits. So be sure to ask for the side effects. Now, there's some medication that have like major side effects. There's a medication that had little side effects. We're not going to spend that time explaining every side effect, because sometimes some people have the paperwork in their hand that they get with the medication, and they would go down every little thing and would pick at every little side effect. Okay, we weigh the risks and benefits. Like even you say, okay, I'm giving you medication for pain, and you come back and say, what is we're going to tell you the medication is going to probably cause some constipation. It's going to make it hard for you to have a bowel movement. And you might say, why are you giving me something that's going to cause me to be constipated? Well, do you want to live with the pain that's so severe, or you can also take maybe a little bit of medication that's going to help along, that's supposed to help you kind of wave away the constipation and all. So which one is more important to you? Also, we give you medication for cholesterol. You might say, okay, I don't want it. Sometimes they say, oh, it hurts my muscles and all. We may say, okay, yes, a supplement to take to protect the muscles and also protect the kidneys. Because you might say, okay, well, then why are you doing that? Again, high cholesterol, you may have a stroke. So we go through the side effects, we do the major ones, and we weigh the different benefits, we weigh the benefits and rates. Okay. So also any prescription, also, anything that is going to cause you to have, like most of the time people I see on, on news, like, okay, well, Black people are not supposed to take lisinopril. They always giving Black people this, and it will cause you to have your tongue will get swollen up and this, all of that. A lot of people take lisinopril and never have no problem, but that's a side effect. And people who are non-Black take that too and take other medication that had other side effects. We weigh all of that before we make the medication, and we make you aware. This is what may happen. This is one of the major side effects. This is what may happen. If that happens, this is what you need to do right away. Also, some other medication can cause you your throat and everything as well. Okay, with your tongue swelling, that's just a serious emergency as well. So we'll tell you, okay, if that's happening, call 911, get to the hospital right away. Here's your EpiPen for something where you can go in there and stick the needle right in your thigh and open up your airway. Okay, so we're not gonna be giving you where we'll talk everything. You can go home also and read it. Even when you even go to the pharmacy, your pharmacies, the pharmacist will usually give you your medication and say, do you have any questions? If you don't have any questions, sign here. So you can also ask at the pharmacy too. I won't suggest going to the pharmacy when it's like really busy and you have more questions to ask, because eventually they're going to say, okay, can you just step aside so we can see the other person, or can you come back another time and we can explain it more to you. Okay, so make sure even when you're at your doctor's office too, if you have to ask that question, you can always call and make an appointment and say, I want to come in to just go over certain medications, because I'm a little concerned about, I read somewhere this side effect, I read somewhere this side effect. Okay. And again, the drugs come in different categories. We got schedule 1, 2, 3, and 4. There's different times. We have medications that pregnant people cannot take. We have medications that women of childbearing age cannot take. Even some elderly people too. I have a lot of elderly patients where if their friends taking this medication, they want to come in and get this medication, or they were getting that medication when they were much younger and they want to take the medication now. Okay, so something called the Beers criteria that we also follow for elderly people. There are a lot of medications I told you guys before, where as you get older, things start to slow down, and your body ability to like clear the medications out of your body, whether through your liver or whether it's through your kidneys and all, it takes a little while for that to happen. So we cannot give certain medications to older people. You can take a medication today, let's say Benadryl, okay? That's on the Beers criteria. We cannot give it to an older person. All right, because if we you say, okay, well, my relative, back home, or my relative over there was taking Benadryl, why aren't you giving it to my mother? My mother needs Benadryl, she needs to go to sleep. You need to be closely monitored, because for older people, that can make them like so lethargic, meaning so sleepy to where they can function. And then certain medications, it doesn't come out of the body quickly with older people. So at the same time, it can make their mouth really dry, make their eyes really dry, their tongue, everything really dry. It makes it very difficult for them to urinate. It makes it very difficult for them to move their bowels. And also they become very sluggish. And that medication, and you know what, as you're older, you have other medications interacting with that too. So at the same time, we have to be very careful as you get older. With children also, we have to watch where they take, because they also, their brains and body, everything is so pretty much immature and is developing slowly. So we have to watch the medications that pediatric patients take too. They're starting to say, why aren't you giving this amount? This medicine works better with her. This medicine works better with this person. Well, we have to, again, everything will be tailored to your individual care. Okay, so something else you might read somewhere, some this and all, doesn't mean, and even some doctors in the same practice where you may go a different thing, doesn't mean either one of them is wrong. They might look at, when you come back for a certain reason, they'll look at it and say, okay, let's look back into your history again and see what's going on. Then we may also have to try certain medications to get to the right where you need to be. Okay, sometimes patients, when we say, I tried this medication, it doesn't work, or it made my stomach hurt, or I just cannot tolerate it. So we may have to try something else. Doesn't mean the first medication that was tried before was wrong. It just means that we had to try this one first, and then we try another one and make sure that it works. And some people, the first medication they get, everything works with them. The level come back, they whatever they're going through, it gets resolved or it's better managed. But some people, you have to try other medications, especially sometimes with psych medications too. You have to try several other medications. Even with high blood pressure, you may have to combine certain medications in order to get the effect that you need. Okay, so okay, how common are the allergic reactions? Did I get to number three? Okay, also let me go back here. Also, there's a medication called that in the really serious part called black box warning. That's the one we have to look at. It's like the strictest warning used by the U.S. Food and Drug Administration in labeling prescription drugs. It is used when there is reasonable evidence that there is serious hazard associated with drugs, such as serious injury or even death. So when some patients would come and say, okay, this medication wasn't working for my pain, or this one wasn't working for my pain. When we prescribe that medication, we do everything to the computer now. So it literally comes up and they will tell you big on the screen, black box warning. So we're telling you, this is what could happen with this medication. This is the reason why we don't want to go to this medication. And sometimes you think it's something major medication, but it could be something minor, not so much minor, but at the same time, it's like, okay, it may not work. And because of your medical history, and also we're telling you this is what's going to happen, or we cannot prescribe that particular medication because this medication could end up causing you your life, okay, or like your livelihood. So no, we cannot prescribe that. All right. So going to how common are the allergic reactions? Again, going back to allergic reactions, okay, you can experience some medications. You take it the first time, you have bad allergic reaction, you get severe rash, and we may have to give you some medication to take care of the rash. Also, give you other things, again, the EpiPen to take care of anything that may cause your throat to swell up, other things like that. If it's a really severe reaction, like back home, we were taking chloroquine for malaria. I mean, it's like, and that used to itch. I mean, to where it's like you almost clawing your skin out. And I came to America and I'm like, and then we were told back home. I mean, I'm not saying that, it's like, okay, that's how you knew it was working. And I was like, and I came out, I was like, oh, when I came to America, I said, really? I mean, there were times where you lay in the bed and you could scratch every part of your skin off because it itches so much. But it was like, oh, okay, that's you took it because that's how you knew it was working. And that's what we have for malaria. So we didn't have anything else to combat their allergic reaction. Some people didn't have itching with it, but some people did. And I was one of those that had like severe itching. So I wish we had, Benadryl or something else there at the time, or maybe it was there, but we were just told that's how it works. So you just had to tolerate that. Over here now, there's no way I would give you a medication and you scratching your skin out, and I'll say, oh, well, that's how the medication's working. So we'll give you other medications to work along with it. Okay. So keep in mind, allergic reactions to medication often require the use of antihistamine, like I said, Benadryl, and some steroids also to control your body response. All right. Some of them may even result in going to the emergency room. So, but again, Again, any medication could do that. Certain medications will do that, but any medication can do that. Every body is different, and people respond to medications differently. So we're not going to get in medication. The medications being tried and going through clinical trials and everything, but some people still have really bad reaction to it. And if that happens, we have to be able to respond. We already do call your doctors, or we tell you call 911 right away and get to the hospital as soon as possible. Okay. Alrighty. So number 5, you say question to ask: how effective is the drug? So before you get to take any medication, it's important to expect. In other words, will this drug cure your condition or just treat the symptoms? Okay, I can tell you. So I give you certain medications. You take it for like an infection, and the infection goes away. It takes care of the infection, and then some medications are there to control it. Okay, some people might say, well, why are you giving medication that if it's not going to cure this? Well, if you have a chronic illness, it may not cure it. So we'll give you the medication that's going to make you live a normal, decent life. Okay, make your quality of life. Like you can go to work, and you can have your family, and you can do things that will improve the quality of life. It's not going to cure it, because there's some diseases that cannot be cured either. So it's to control it. Okay. So for type 2 diabetes, usually again, with medication, you're taking type 2 diabetes, it could completely reverse it. Okay, complete of course, when you're taking that medication, you have to be eating healthy as well. But sometimes the certain medication that we start you off with that can really affect your stomach. So you might say, why would I want to take this medication? But you have to take it, and then also take it with how you take it with food, so it doesn't upset your stomach. Certain medication, we might say take it on your own, take it on the empty stomach. So the therapeutic level of that medication. Let's say you're taking medication for your thyroid. Okay, you have to take it in the empty stomach. It has to be 1 hour away from other medications. If you don't do that, you come back, your level will not be therapeutic to where it needs to be. Therapeutic meaning we have a certain range that it has to be there. Because if it's not in there, you're going to start having the side effects. You're going to start suffering the different effects of that disease. So it's important that you do that. Okay, and understanding how effective the drug is, and as well knowing exactly what it does. So we'll tell you what the medication does. We're not going to sit there and explain all the pharmacokinetic and the biological part of all the medication. That's totally impossible. Okay, we'll tell you like the main part of it. And if you want to go back and research again, like I said, don't come back. But if you come back and say, I have a question, make sure you have a good rapport with your doctor and say, something bothering me, or I read here, can you explain this to me a little bit more? And then we'll tell you that. There's not enough time in the day to sit there and explain everything about a medication. When we take our pharmacology course, it's very intense. So we're not going to be explaining everything to you. There's no way you're going to understand all of that anyway. Some people cannot, some people understand it. What if you have, a degree in chemistry, or maybe you one of those people who like to read in depth? It's good, but we're not going to have the time to explain everything to you. So we're explaining major parts of how the medication work. Sometimes I tell people, I say, okay, you need to take this medication. And they say, well, I'll be doing that. And I say, you eat healthy, you take this medication. This is how the medication works. And I explain that. And then when you come back, we'll do the blood work to make sure you're fine. Okay. And also with certain medications, we say again, going back to already, you can't take certain birth control pills. If you smoke, we cannot do that because you have a higher risk of having a blood clot. Okay, so we cannot give you that. So you can say, well, my friend taking this, how come you can't give it to me? Or my cousin did this, or my sister did this, you can't take it. There's certain medications you can take, blood pressure, contraception, which is birth control medication, if you're overweight. Okay, because the medication may not be effective. So you say, oh, do you want to end up pregnant? So this is the reason why we can't give you that medication. Okay. Or if you had some issues before with your heart, or you had a blood clot before, there's certain medications we cannot give you. So when you ask this question, you say, why can't I have this medication? We'll explain that to you. And it's not being like, okay, I'm being mean, I don't want to give you the medication, but we have to explain this is the reason. We look at your medical history, we're looking at your labs, we're looking at your family history, and we're looking at everything else that's going on in your life. No, you cannot take that medication. There's certain medication we take that you're supposed to help you with the pain, but they also make you groggy. We may say you can't take this medication until you get home. Take something that will make you less groggy because you have to work. Okay, so take it sparingly. Use it only as needed. Take it at the end of the day when you go into bed and when you're really tired and all that. And the pain is there, you can do that. But take something else in between for breakthrough pain, so you're not groggy, so you can be able to have a functional life. Right? So the other number 6. I think I got it. How long do you have to take this drug? Okay, so again, and that's a good question. You'd be like, oh, because some people say the first thing, if I tell them, okay, I'm putting you on this medication, they'd be like, how long do I have to take it? This is usually one of the main questions we get. How long do I have to take it? I say, well, If your cholesterol level is high, you don't have to, if you're eating healthy and you exercise, and you don't have to take it for that long. If you're taking an antibiotic, it's usually like, anywhere between 7 to 14 days. If you're taking medication for your blood pressure, it's going to, we're going to be giving it to you for a while, your blood pressure. And sometimes I tell my patients, okay, over time, take your blood pressure in the morning and in the evening and record it. Make sure you keep a nice log of your blood pressure. Okay, get your heart rate too, and then bring it, and we'll see where you are. Because when you're in the office, your numbers may be a little high, or whatever it is. That some people leave their work and they come running to the office for appointments, so your blood pressure may be high. So we'll sit you down for a little bit and get you rested and a little more relaxed, and do your blood pressure there. And I would say take it at home too, and make sure you keep it down. So, and bring it, and we can do that. So you may not have to be on this blood pressure medication for too long, or you may have to be on a blood pressure medication for a while, because we're protecting you from other things too. Okay, let's say if you have diabetes and we put you on medication and your cholesterol levels a little bit, and you have other risk factors, we may put you in cholesterol level at a lower rate to also complete it. Some diabetes medication can also protect your heart. So you might say, why are you adding another medication to this? And I say, remember, your cholesterol level is high. You have other reasons. You have family member that had a stroke. You had other reasons. And so we're trying to protect that. So certain medications, we do that. This medication may help you lose the weight too. So if you lose the weight, your cholesterol level may come down too. So there's so many things that go into that. Okay, so if you take the medication, I've taken so many people off their diabetic medication after a while. Of course, I tell them, I say, make sure if I'm taking you off, that means you can't go back to just having a good time. Okay, because as humans, that after a while, you just want to go back and have a good time. You'd be like, okay, I'm not on this medication anymore, or I can eat a little bit more, I can be a little, and your brain tells you, okay, I don't have to worry about that anymore. But you have to make sure that you're eating. And again, like I tell people, if you're diabetic, one person's diabetic in the family, everybody has to eat healthy. You can have one person sitting there eating really good food, and the other person sitting there chewing on a carrot. Okay, so make sure that it becomes a lifestyle change for everybody in the house. Now, I don't want you saying, well, I don't have diabetes, why do I have to starve myself? If you're biologically related to that person, not like your husband and wife, you're not biologically related. Like if you're the child, okay, you may say, okay, I want to make sure that my child doesn't have diabetes at an early age, because the early you have diabetes, you have to, the complications can come a lot earlier in that. So you want to make sure you do that. Cholesterol, anything, they tell you, you don't have to. So talk to your doctor, say, I'm going to take this medication, but how long do I have to take it? What do I have to do for you to take me off it? So have that conversation, have a good rapport with your doctor. And again, if you don't feel like you're getting the kind of answers that you need from the doctor that you're with, I say doctor as opposed to say provider. Okay. But I'm used to say doctor. So making sure doctor, PA, NP, and all that. So making sure that you say, so, okay, how long do I have to take this medication? Because some people just don't like taking medications. I'm one of those people who don't like taking medications, even though I'm in healthcare. So I do a lot, but there's certain things where you have to take medications. There's no other way around it. You have to take the medication in order to have a functional life. But you can say, how long do I have to take this medication? I don't mind taking it. But can I take it this time of the day? Can I take it that time of the day? Is also important to also make sure, because this time of the day I have to go to work. I work in a place where I have to do a lot of standing. I work in a place where I have to concentrate. So I can't take this medication. Can you give me another medication where I can take a different time of the day so it doesn't affect me? There are some people who work overnight, and diabetic medication work a certain way. So you can talk to your doctor and say, okay, making sure that I need to do something else. Can you give me an alternative to this medication? So do that. So the most important thing, I think, let me just review before I look at my questions over here. All right. And just here. So again, the top 6 questions, you can have many more questions. There are many questions patients ask me, and sometimes they come in with a whole pile of paper and like, okay, it says here, and they've been like maybe like 20 pages. I'm like, okay, let me see. What is it that you really need to know? Then we can go over it. And it's the important stuff. And other making appointments so we can come back and do this. And also, I want to say, we also have to do medication reconciliation every time you come into the doctor's office, and also when you go to the hospital. So every time you come in and we say, okay, let's see what medications you're on now. Some people might say, well, you're my doctor, why are you asking me all these questions? No, we want to make sure, because there are times that people go to other doctors. We don't always get their consultation notes right away. So we may decide that, okay, this is your weight, that's the medication that you're on, so we can take that off. Because when you start putting medications together, it's like, okay, this is interacting with this should be avoided. Well, if you're no longer taking that medication, then that means I can prescribe this other medication for you. So I want to make sure that you're no longer taking that medication, or the dose of that medication. I can also give you a different dose of the medication I want to give you, because the dose of that medication has been lowered, or you no longer take it. So every time you come in, medication reconciliation. That's the reason why I say always have your most current list of medications with you. You can go to your pharmacy. If you go to more than one pharmacy, you can have the current list in your phone and be able to put it in a way where you can go back and then change it when you get new medication. So you don't just have a picture of your medication and some of it may have been changed, and we're operating with that list. Again, we don't always get family doctors, don't always get a consultation notes by the time you come back to see us. And sometimes the patient will be like, everything that I went to see this doctor is already there. No, not necessarily. Even sometimes when you go to a hospital, we don't get the discharge instructions right away, the discharge summary right away. So it's important that you have a current list with you at all times. Okay. So going back, number one, what will happen if I don't take this medication? Number two, is taking this drug the only option? Let me put here. I did my paper over this way. Okay. How effective is this drug? I think I just went a different order there. How long do I have to take this medication? All right. So I think I got it all. And what are the risks and benefits of taking this medication? Okay. Like again, like I said, we'll give you the major benefits, risks, and all that, and we go on from there. And a whole lot, again, to reiterate this, the whole lot goes into diagnosing you, and also prescribing medication. And we don't just prescribe medication just for the heck of it, because every time you prescribe a medication, we're taking responsibility for that medication. So, and we take responsibility for anything that could go wrong with that medication and you. So, we're talking about malpractice, and also it's not just saying, yeah, it's a medication, take it. Yes, a medication, take it. So there's a lot that goes into prescribing the medication. But feel free to ask your doctor, and again, have a good rapport. And if you don't feel like you're getting the treatment that you want from that doctor, again, like I said, I did another show on how to pick a new doctor. You can always change doctors, okay? But I did do a show on how you can go about that, so you're not interrupting your care. Because if you have chronic illnesses, you don't just want to say, you know what, I don't need you to be my doctor anymore, and then you go to somewhere else and you're trying to look around to find doctors, and nobody's taking doctors in your area, or you don't feel okay there, and then you have chronic illnesses and you have need medications that need to be renewed, and nobody's renewing it. So it's important that you do that. Okay. I've had people tell me, I don't want you to be my doctor anymore. And like, and then, get cussed out. And then, 2 months later, they come back. Well, I'm like, oh, okay, welcome back. How are you? It's like you go with the flow, right? Because there are times where, and there's nothing wrong with that. There's some people you just don't gel with, regardless of whether they're in the medical field or whatever field. You don't gel with them, and you want, especially when it comes to your health, you want to go to somebody who you feel very comfortable with, that you can ask questions and don't feel that that person saying, are you questioning my authority? Are you trying to say you know more than me? If they come off that way, you'd be like, okay, this is not where I need to be. I need to be somewhere where I can sit there and ask questions and feel comfortable that they're not going to berate me or make me feel like I shouldn't be asking these questions. Okay. So let me just go in here and see something. Okay. Just gonna be a couple of guys. Stanley Thomas say he is watching. Dr. Henry Peabody. Thank you. Very helpful. And let me go in here. Augustine Lucia said, good evening. Hi. Thanks for watching. You always watch. Thanks for all your support. And Albert Moore, for all your healthcare. Follow her. Thanks, Albert. I got a couple of friends on today. Thank you. And Emmanuel Jackson said, watching from Boston. Hi, Emmanuel. How are you? I haven't talked to you in a while. And Alicia Ray says, slow down, small. Sorry. And let's see. Kadusha Moses James said, thanks, Abby. Thank you so much. And thank you for all your support. Alicia, sorry, I was slow down. Is that Alicia? Yes. Okay. Sorry. Okay, so let me go back here. And okay, so I hope what I said today has helped you guys. If you have any questions or comment, please leave it below. I usually go back later on and read and all that, and ask about that. So bottom line is, don't feel scared if you have to ask a question from your doctor, your provider. If you're in the hospital, don't feel free. Don't feel afraid. Ask the nurse to, or the doctors usually when they come in, they will tell you, I'm going to be prescribing this. They may not tell you exactly what they're prescribing. And then the nurse comes in and they bring their medication, all that. Don't wait till it's already opened up and then you ask them 10,000 questions. Make sure you ask them first. Oh, what are you giving me? The nurse is supposed to be telling you that too, anyways. Because I always say, I tell you what it is and you know your body. And then I explain because the nurses also, the pharmacology courses, different from what the doctor took. But so they will explain to you what's going on and it goes on from there. And if you have any questions, you can always say, oh, I want to speak to the doctor because I don't think I should be taking this medication. And of course, they'll let the doctor know. But if you're in a primary care setting where I work, making sure that you have a good rapport with your doctor. And if you don't have that rapport with your doctor, don't just say, I'm going to get up and leave. Make sure you talk to them first and just say, okay, I just want to have a heart-to-heart conversation with you because I feel a little nervous about taking these medications, and explain to them everything that's going on. Usually, we can work things out. Okay. So I thank you all for watching tonight. For those of you who watch along with me, I say thank you. For those of you who will be watching later, I say thank you as well. And I hope you all have a good night. And if you like this show, please give me a thumbs up. Please follow. I'm still trying to get up to 1,000 before the years. And please share the show to your different pages and to your friends. You and I may not have the same set of friends, so better you share it, and that way somebody else can see that. So leave your questions and comments below. And good luck. Thanks for watching. Good luck. Thank you all for your love and support. Good night.